my sterile gloves. Remember, I'm going to grab the inside cuff of the first glove. I'm going to put my sterile glove on, making sure only to touch with my dirty hand the inside of that glove. Then my sterile fingers are going to go underneath the cuff of the second glove. Incidentally, your hair needs to be up and out of the way. When I work, I never have my hair up. So you think I can put my hair back without breaking my sterile film? It's a test. On video.
We still need video evidence of it, John.
Okay. New hand, hitchhiker thumb up and out of the way. In the zone. Okay. Now I can play my field. What do I have in my kit? I have a couple of drapes. Extra pair of sterile gloves just in case. I have some betadine, and we know that Mrs. Garcia is allergic to betadine, so I'm going to get rid of that. I have my hydrogen peroxide. I'm going to open that up and pour it over my cotton. For the purposes of your practices, don't open this up because you can take these kits home and practice. But in your checkoff, you'll open up your hydrogen peroxide, pour it over your cotton. I'd open up my KY, pour it in my tray. Okay. Now I'm going to assess my balloon. And these particular catheters, usually the latex ones, they do recommend that you check the balloon, like they said in the video. A lot of the silicone ones, they don't. And what I'm checking for is I'm filling it up to make sure it fully inflates, make sure there's no leaks, okay? And then I'm also checking that it deflates, because that's your real problem, okay? I want to make sure that it deflates all the way, because if it doesn't deflate all the way, then it's not going to be able to be removed from the patient, and then you're going to have a urologist come, and it could possibly even mean some kind of a surgical intervention or something. So I can leave this attached to my balloon, or I can do it later. And then I'm going to take this plastic sheath off, being careful not to have it fling all around and become contaminated. And now I am ready to create my sterile zone. So I'm going to ask Mrs. Garcia, can you please move your drape or your blanket up above your waist? That's you, Mrs. Garcia.
Right.
Thank you, Mrs. Garcia. Okay. So I'm going to create the sterile field. Remember, shiny side goes down. Remember how I protect my hands? Remember? I'm going to go between the legs. I have another drape so I can extend my field. I don't use the fenestrated drape on the female patient like a bullseye. I feel like it gets in my way. So I don't like to use it on the female. I use it on the male unless I'm going to use it like this to create a little extra spot up here, but I don't make like the bullseye. Okay, you can do what you want. It's fine. Now I'm ready to go between the legs. So I can pick up my kit and place it into my sterile field. Okay. I'm going to open up the labia, and now in real life, with these mannequins, we're just doing like this, okay? In real life, there's a lot of tissue down there, okay? So you're going to get your whole hand in there. The wider you can open it up, so I take this finger to this thumb, and I open it all the way up, You're having a better visual field. It's not dainty, it's purposeful. I'm on a mission to catheterize. Okay. That doesn't mean rough and painful. It's just purposeful. I'm opening it up, and oftentimes I have to actually pull up a little bit too, because gravity, tissue kind of sinks a little bit. Okay. And so I'm opening it up so I can see what's going on. Okay. So in these mannequins, though, they're like just rough. Okay. So yeah, you can see very easy. There's going to be no. So I'm going to take my hemat, clean the area away from me, clean the area towards me, clean down the center, being careful that the labia don't close, because if they close, I have to start over. Okay. So now when you're looking at the labia, you're keeping your eyes on it the whole time. Okay, and you're looking for the meatus. The meatus on the female patient is obviously much more harder to find than it is on the male patient. Okay. And so you're looking for a pooling. The good news about the betadine is that it's dark. Okay, and so you'll see it pool. So you're going to see some pooling. It's going to look like a crescent where the meatus is. So look for the pooling. Okay, and as you're pulling down, you're going to be looking for what we call the wink. Okay, and so say this is your meatus. Okay. I'm wiping down, the meatus opens, and then it winks closed. Okay, so you got your wink. That's what you're looking for. Did I miss? I didn't miss it. Thanks for pointing out the obvious. Good job. So what should I do? Get new gloves. Okay. Thanks, Shauna. Okay, I've got new gloves on, I've got a whole new kit, and I've re-cleaned the orifice that you now know winks at you. Now I'm going to, I eye spy it. Once you see that wink, you just keep your eye on it, take your catheter, lube it up, and you start feeding it in to the urethra. You'll go and go. You'll see a flash of urine. You're going to be looking in the clear tubing. When you see the flash of urine, you're going to continue on for like another inch or two. Then you're going to hold the catheter in place, and then you're going to inflate your balloon. Some of these are defective.
Camera have a spray shield, right?
I don't think so.
Okay, inflate the balloon. Then I'm going to gently pull it back till I get some resistance. Okay, so now I'm done with the placement. I'm going to tape the catheter to the thigh. I'm going to clean the area with a washcloth to get the betadine off the skin, because it can be irritating to the mucous membranes. I'm going to hang this at the bedside after this is taped.
You mean the
Okay.
hydrogen peroxide, not the betadine, because you didn't use it because she was allergic.
Correct, but if she has betadine, you need to wash it off.
Okay.
Yeah. You're going to most often use betadine. The bag needs to be hung on the bed frame, not the side rails or anything that moves, so it moves with the patient. Okay. I can put this for transferring and stuff. I could put it at the bedside. I don't ever want to raise it above the patient. Why? Right, you're going to get some reflux into the urine. Okay.
Sometimes, like, if the patients are movable, I mean, they can transfer by themselves,
Mm-hmm.
then even it's very harmful to, put in the bed frame. They try to move and try to get out of the bed, and then, king.
They should be asked to call for help to get out of the bed, because it needs to be lower, so it needs to be hooked to the bed
But
frame.
most of the time, we put in the basin nowadays, rather than hooking basin within a towel. And
Where
down.
are you talking about?
in the place where I work in,
What kind of facility is it?
nursing home.
A nursing home? Okay.
Because they try to get up and then try to walk.
Because in the
and they
nursing
pull the
home,
catheter.
in the nursing home, you're going to have patients that have chronic catheterizations. So they're going to have caths all the time, and they only change them once a month. And so they're much more mobile, and they do have them all the time. So he's saying at his facility, what happens is they're not hanging them on the bed frame because patients are pulling them out. They're putting them in a basin on the bed. So that's the evidence that their facility uses, okay, for safe patient care, so the catheters don't become dislodged and come out. In the hospital, and in the NCLEX hospital, which is the perfect hospital, okay, the correct answer is to hang it on the bed frame, okay. You may see, depending on facilities, some things that are different, okay. But the right answer, the take-home message is it hangs on the bed frame. It can lay on the bed in a basin is what they do. It needs to be below the bladder, never above the bladder, okay. So those are your must-knows. Okay.